Okay, the American Medical Association says cuts to the payments Medicare makes to doctors is threatening patient care. The most recent cut took effect January 1st, reducing reimbursements by more than 3%.
Joining us now is Dr. Shadi Kharosh. She is one of the representatives of the American Academy of Dermatology to Congress. Doctor, thank you so much for joining us, and good morning.
Good morning. Thank you. Good to be here.
So the first question here, what is the impact on patient care, and does it affect just seniors?
There are a lot of concerns that these Medicare cuts are going to cause additional strain on the already strained healthcare system. Right now, patients are facing long wait times throughout the country, throughout the healthcare system. I'm at Mass General, and I'm often speaking to you from Mass General. Today, my views are my own, but I can tell you, having served as one of the representatives of the American Academy of Dermatology, meeting with members of Congress and seeing the impact that this is having, our national medical organizations are contacting their members of Congress, meeting with many members of Congress, sending letters to explain the additional strain that this will have. And the strains will take the form of longer wait times. Right now, we have a real access problem in terms of patients having to wait months to see their doctors, whether that's their primary care doctor or their specialist dermatologist like me. And there are concerns that these wait times are going to be even worse, and that because people can't access their doctors, they're going to the ER instead. And I can tell you that at Mass General, for example, our ERs have been at capacity. There's something called disaster capacity status, where the ER reaches critical levels of overcrowding. And we've been at capacity almost every day. So there is concern that with Medicare cuts, these problems might become even worse.
What's the impact on the doctors, treating patients and private practice doctors?
Well, I think that there's a concern among a lot of clinics that if the Medicare funding falls below the level of the operating cost for a practice, for example, if Medicare funding is below the cost of delivering services to patients, that would be unsustainable. And as I mentioned, that has a ripple effect of impacts throughout the healthcare system that then lead to long wait times. Because if clinics have to close, then we have an even greater workforce shortage, and we'll see patients, for example, coming to the ER when they shouldn't be, when they should be able to access their doctors.
What can people who are concerned about this issue do now?
Well, there are already measures being taken. There is a bill in Congress right now called the Preserving Seniors Access to Their Physicians Act. There are a few other bills in Congress right now. And our national medical associations, like the American Academy of Dermatology and the American Medical Association, are actively working with members of Congress on bills like this. And this has bipartisan support. So, members on both sides of the aisle are supporting it. And also, our members of Congress who are doctors have been very vocal about this issue. And they have been speaking on Capitol Hill, explaining to their fellow members of Congress what the impacts of Medicare cuts would have on the healthcare system. So this is something that we can all work on together, and contacting our members of Congress. This is something that both doctors and patients can do. And there's information, for example, about this online. The American Medical Association has posted a website called fixmedicarenow.org, where people can go on that website and learn more about it and learn how to contact their members of Congress.
Okay, we can put those links on our website too. Thank you, Dr. Shadi Kharosh, known locally as the Director of Dermatology Division at the Community Health at Mass General and Associate Professor at Harvard Medical. Have a good weekend.
Thank you.